You are welcome to the International Herbal Medicine Centre, England. This episode is titled, 10 Signs That You Have Cancer. We are going to look at 10 signs of cancer. When cancer is detected at an early stage, it is often more treatable and curable. Treatment options may include surgery, radiation therapy, chemotherapy, immunotherapy, or targeted therapies. The choice of treatment and its success can be significantly influenced by the stage at which cancer is diagnosed. Cancers that are diagnosed early have a higher chance of being successfully treated, leading to better long-term survival rates. Early detection can potentially prevent the cancer from spreading to other parts of the body, which is a common factor in advanced stage cancers. Please subscribe to our channel if you have not done so. Here are 10 signs of cancer. 1. Unexplained weight loss can be a potential sign of cancer. While there are many possible reasons for unintentional weight loss, cancer is one of the more concerning underlying causes. Significant and unexplained weight loss is typically defined as losing 5% or more of one's body weight over a span of 6 to 12 months without any deliberate changes in diet or exercise. Cancer can lead to weight loss through several mechanisms. Metabolic changes. Cancer cells can alter the body's metabolism, causing it to burn calories at a faster rate. This can result in weight loss, even when a person is eating a normal or increased amount of food. Appetite suppression. Some cancers produce substances that can suppress appetite or cause nausea, making it difficult for a person to eat and maintain their weight. Difficulty swallowing. Cancers of the esophagus or throat can make it painful or challenging to swallow, leading to reduced food intake and weight loss. 2. Fatigue. Persistent and unexplained fatigue that doesn't improve with rest can be a symptom of various cancers. Fatigue can be a sign of cancer, although it is a non-specific symptom that can be associated with many other conditions as well. Fatigue related to cancer is often described as severe, persistent, and not relieved by rest. It can interfere with a person's daily activities and quality of life. Some cancers can lead to anemia, a condition characterized by a low level of red blood cells. Anemia can result in fatigue because it reduces the blood's ability to carry oxygen to tissues and organs. The presence and growth of cancerous tumors can consume a lot of the body's energy and resources, leading to fatigue. 3. Skin changes. Changes in the skin, such as the development of new moles or changes in the appearance of existing moles, skin sores that don't heal, or yellowing of the skin and eyes, jaundice, can be signs of skin cancer or other types of cancer. Changes in the skin can be a sign of cancer. Skin changes are among the most noticeable and common warning signs of various types of skin cancer and other malignancies. It's important to be aware of these changes and promptly seek medical evaluation if you notice any suspicious skin alterations. The 3 primary types of skin cancer are melanoma, basal cell carcinoma, and squamous cell carcinoma, and they can manifest with different skin changes. Melanoma. Melanoma is the most deadly form of skin cancer, and it often presents as a change in an existing mole or the appearance of a new, unusual mole. 4. Changes in bowel or bladder habits. Persistent changes in bowel habits, such as diarrhea, constipation, or blood in the stool, can be indicative of colorectal or other abdominal cancers. Similarly, changes in urinary habits, such as blood in the urine or frequent urination, may signal bladder or prostate cancer. Changes in bowel or bladder habits can potentially be signs of cancer, although they can also be caused by various non-cancerous conditions. It's essential to pay attention to any persistent or significant changes in your bowel or bladder habits and seek medical evaluation if you experience any concerning symptoms. Here are some ways in which changes in bowel or bladder habits can be associated with cancer. Changes in bowel habits. Bowel obstruction. Some cancers, particularly colorectal cancer, can partially or completely block the bowel, leading to symptoms like constipation, diarrhea, narrowing of stool, or a feeling of incomplete emptying. Blood in the stool. The presence of blood in the stool, which may appear as bright red or dark, tarry stools, can be a sign of various gastrointestinal cancers, including colorectal cancer. 5. Lumps or swellings. Any unusual lump or swelling in the body, whether in the neck, underarm, abdomen, or elsewhere, should be evaluated by a healthcare professional. Many conditions can cause lumps or swellings, including infections, cysts, benign tumors, and various non-cancerous growths. However, certain types of lumps or swellings may be associated with cancer, and it's essential to have any unusual or persistent lumps or swellings evaluated by a healthcare professional. Here are some situations where lumps or swellings may be related to cancer. Lymph node enlargement. Swollen lymph nodes, especially if they are painless and persist for an extended period, can sometimes be a sign of lymphoma or metastatic cancer. Testicular lumps. A lump or swelling in the testicles can be a sign of testicular cancer. Soft tissue sarcomas. Soft tissue sarcomas are cancers that can develop in the soft tissues of the body, such as muscles and connective tissues. 6. Persistent indigestion or heartburn. Ongoing indigestion or heartburn that doesn't improve with over-the-counter medications may be associated with stomach or esophageal cancer. Persistent indigestion or heartburn can potentially be a sign of cancer, specifically esophageal or stomach cancer. While indigestion and heartburn are more commonly associated with less severe conditions such as gastroesophageal reflux disease (GERD) or peptic ulcers, it's important to be aware of the possibility of an underlying cancer when these symptoms persist or worsen over time. Here are some key points to consider. Esophageal cancer. Persistent heartburn, difficulty swallowing, dysphagia, or a feeling of food getting stuck in the throat or chest can be early symptoms of esophageal cancer. Esophageal cancer is more common in individuals with a history of chronic GERD or Barrett's esophagus, a condition where the lining of the esophagus changes due to acid reflux. Stomach cancer. Indigestion, abdominal discomfort or pain, bloating, and nausea are some symptoms of stomach, gastric, cancer. These symptoms may be mistaken for common digestive issues, but if they persist, they should be evaluated, especially if they are accompanied by unintended weight loss. 7. Difficulty swallowing. Difficulty swallowing, also known as dysphagia, can be a symptom of esophageal or throat cancer. Difficulty in swallowing, also known as dysphagia, is not a direct cause of cancer. Instead, dysphagia can be a symptom of certain types of cancer, esophageal cancer, but it is not the cause of cancer itself. Esophageal cancer is a malignancy that develops in the esophagus, the muscular tube that carries food and liquids from the mouth to the stomach. Dysphagia is a common symptom of esophageal cancer and typically occurs when the cancer obstructs or narrows the esophagus, making it difficult for food and liquids to pass through. 8. Cough or hoarseness. A persistent cough, hoarseness, or coughing up blood can be signs of lung or throat cancer. Cough or hoarseness can be symptoms of certain types of cancer, particularly those affecting the respiratory and vocal tract areas. While these symptoms are more commonly associated with non-cancerous conditions like respiratory infections or voice strain, they can also be indicative of cancer, and it's important not to ignore persistent or concerning symptoms. Here are some cancers where cough or hoarseness may be warning signs. Lung cancer. Persistent cough, often with the production of blood-tinged sputum, can be a symptom of lung cancer. Throat cancer. Cough and hoarseness can be early symptoms of throat cancer, which includes cancers of the larynx, voice box, and pharynx. Hoarseness is a common symptom when the cancer affects the throat. 9. Pain. Ongoing or worsening pain, especially if it's localized and doesn't have an obvious cause, can be a sign of cancer. Pain can occur in the affected area or may radiate to other parts of the body. Cords. 10. Neurological symptoms. Depending on the location of a tumor, cancer can cause neurological symptoms such as headaches, seizures, vision changes, or weakness in specific body parts.